Hello and welcome to Nutrition and Healthy Eating. This is session 8, and in this session we're going to be talking about nutrition requirements across the various stages of life. We're going to be focusing on pregnancy, infants, children and adolescents. We're going to be focusing on the macro and micronutrients that these populations require, and then also discussing some of the factors that may influence their risk of developing particular diseases throughout this period of time. So let's get started. Now, during the years before pregnancy, known as preconception, the 9 months of pregnancy, and the years after pregnancy, our diet and nutrition can significantly influence the health and well-being of both the mother and the infant. Let's learn more. Nutrition for a healthy pregnancy can include many different areas. Okay, the first area we'll discuss is vitamins and minerals. Okay, particular nutrients are required in higher amounts during pregnancy and will actually require this supplementation. We'll discuss this in a lot more depth in the following slides, but just to give you a brief overview, some of these will include folic acid, also known as folate, iron, calcium, vitamin D, iodine, vitamin A and omega-3 fatty acid, especially your DHA fatty acid. These are just a few of the vitamins and minerals which are essential during pregnancy. Other areas that we'll be discussing is the awareness of foods to limit or avoid during pregnancy, because these can actually have an effect on the outcome of the pregnancy. And these food products may include caffeine, mercury, alcohol, smoking, particular bacterial infections. Also worth mentioning is the prevention and management of conditions such as neurotube defects, gestational diabetes, hypertension, excessive weight gain. All of these areas that I've just mentioned fall under the umbrella of nutrition and healthy eating. The Australian government have developed a healthy eating guideline for pregnancy, which has 5 main points. Now, these include to achieve and maintain a healthy body weight, be active and choose amounts of food which are nutritious. Now, enjoy a wide variety of nutritious foods from all 5 food groups daily. Of course, limit intake of foods containing saturated fat, added salt, added sugar, and alcohol. We'll discuss alcohol in a bit more depth later on. Now, number 4 is the main one for pregnancy, and it's to encourage, support and promote breastfeeding. And the 5th is to care for your food, prepare and store safely. Okay, let's discuss these nutrients, these micronutrients required during pregnancy. The first nutrient we'll take a look at is folate, also known as folic acid. Now, what's quite important to note here is that folate or folic acid is important during preconception care. Okay, so the time in which folate is required the most to prevent some of these ill effects such as neurotube defects is actually the first trimester. So that's the first 3 months of pregnancy. Now, this is an interesting one, as a number of young females may not know that they are pregnant until 8 weeks into their pregnancy. So it's important to note that all women of conception years or reproductive years should ensure that they have adequate folate within their diet. Now, the reason why folate is so important during this first trimester is it can actually support with the development of the brain, the spinal cord, and actually prevent something called neurotube defect right here. And this is an image down here. Now, supplementation or multivitamins will generally contain about that 400 micrograms, and it will read as folic acid or folinic acid. So these are the synthetic forms of folate which can be used in supplementation. Now, folate is also found, of course, within our diet, and it should be included. These particular foods should be included within our diet, especially those who are of reproductive age, to ensure adequate folate intake. Now, these foods would include things like sunflower seeds, peanuts, vegetables such as broccoli, spinach, Brussels sprouts, lentils, chickpeas, and particular fruits such as avocado and papaya, edamame as well. So ensuring adequate supply of these foods during reproductive age and during the first trimester is essential for reducing the risk of neurotube defects in the fetus which is developing. The next essential and very important nutrient to discuss is iron. Okay, iron helps to build new red blood cells, the hemoglobin, to carry the oxygen. Now, during pregnancy, the amount of blood actually increases by 50%. 50% increase in blood. Now, this is to meet the needs of both the mother and the fetus. So, to actually make more blood, we require iron to make the hemoglobin to be able to carry the oxygen around. Now, a daily multivitamin or a pregnancy multivitamin will contain around the 16 to 20 milligrams of iron. However, on top of that, it's recommended to get iron from your diet as well. Now, this may include things such as beef, lamb, chicken, and fish. Bearing in mind there is some cautions and recommendations when it comes around to the consumption of fish in relation to mercury, and we'll discuss that in a few slides' time. Other sources of iron include pumpkin seeds, cashews, pine nuts, hazelnuts, or a lot of your nuts and seeds, fortified cereals or milk products, and of course, your green leafy vegetables such as spinach. Now, we know with this non-heme iron foods, to actually increase the absorption of iron, we can actually add foods which are high in vitamin C. So this would include kiwi fruits, citrus fruits, tropical fruits. These foods which are high in vitamin C can actually aid in the absorption of non-heme iron. The next micronutrient to discuss is calcium. Yes, supports with healthy bone, healthy teeth, heart function, nerve function, muscle development. Without sufficient dietary calcium, then what will actually happen is calcium from the mother's bones will actually be drawn upon and taken to support fetus development. So the fetus won't actually be, lacking in calcium if the mother doesn't consume calcium. It just means that the calcium will come from the mother's bones rather than her own diet. Now, this can lead to a few obvious risks, such as osteoporosis. So ensuring that there's adequate calcium intake within the diet is essential during pregnancy. Now, unlike folate and iron, calcium supplementation is not recommended during pregnancy or not necessarily required in the vast majority of individuals. However, what is recommended is 2 servings of milk or the alternative each day to ensure adequate calcium intake. So some of these foods which are high in calcium will include skim milk, fortified soy beverages, cheeses, yogurts, And our non-dairy sources, such as green leafy vegetables, broccoli and spinach, but not spinach, sorry. Spinach was high in iron. You'd be more looking at the broccoli and cabbage, okra as well for calcium. Omega-3. We all know that omega-3 is one of my favorite components, one of my favorite nutrients, for good reason. Now, we'd all remember that omega-3 is our anti-inflammatory nutrient that we can draw on. Now, during pregnancy, its anti-inflammatory effects are secondary, and it's more focused on the influence that omega-3 can have on brain development and eye development. Now, what's quite interesting is, yes, supplementation is recommended during the third trimester. So the last 3 months of pregnancy, omega-3 is recommended to be taken. That is because during this period of time is when the fetus's brain and eyes are developing, and this is when omega-3 is most needed. Although some may take omega-3 throughout pregnancy, it is in the third trimester where it's most important. Now, as we would remember, there's two different types of omega-3. You have your DHA and your EPA. Now, in this case, for fetus brain and eye development, it's actually DHA, which is the most important fatty acid for this type of development. Of note is there is insufficient amount of DHA found in food to support optimal pregnancy. Now, this isn't saying that let's go. High omega rich foods include fish. Now, the caution in regards to fish, and we'll discuss this next, is that fish can actually have high amounts of mercury. So if we go to actually increase fish in the diet to support with our DHA levels, then we may actually increase mercury too high and then thereby cause more complications. So fish shouldn't necessarily be the primary source of a DHA during pregnancy. Potentially a purified fish oil supplementation is actually required. That is because you've got your other sources of omega-3, your chia seeds, your hemp seeds, your flax seeds and walnuts. The issue with these particular food items is that only about 4% of the omega-3 in these foods will actually be converted to your DHA and EPA. Okay, so I alluded to this earlier, and let's discuss this now. There are a number of foods that should be limited or avoided during pregnancy. The first one is fish. Okay, so large fish contain a higher amount of mercury in comparison to smaller fish, because larger fish eat smaller fish and mercury builds up within their system. So the recommendation when it comes around to fish is no more than one serve, so that is 100 grams of cooked fish per fortnight of your larger fish, such as a shark, swordfish, okay? And then no other servings of other fish during that fortnight. The other recommendation is one serve, so that's that same 100 grams of fish per week of these smaller medium fish, such as catfish. Now this is per week, which is different to these larger fish. So an easy way to remember this is the larger the fish, the less frequent a pregnant woman can consume this in comparison to the smaller fish. There's a bacteria called Listeria, okay? And it can grow on particular foods. And in normal individuals who are healthy, who are not immunocompromised, who are not elderly, who are not pregnant, this particular Listeria bacteria causes no major significant problem. However, during pregnancy, it can cause early contractions and abortions and so forth. Miscarriages, might I say, and then thereby should be avoided. Now, this Listeria bacteria is found on things like soft cheeses, sandwiches, bean sprouts, foods which have been chopped and prepared and left open for a long period of time. So during pregnancy, fresh is best. Other things to avoid are raw eggs is a high on the level of foods to avoid. Now, alcohol. Interesting one. From a research perspective, it's continually changing how we look at alcohol in pregnancy. 1 week, it'll come out that drinking a glass of wine every week is supportive for pregnancy. The next week, it will come out that drinking a glass of wine causes detrimental ill health during pregnancy. The general consensus is not drinking is the safest option and should be followed. Okay? Caffeine. We all love caffeine. However, during pregnancy, caffeine should be in moderate consumption. Now, I would strongly advise that you remember this number here. Limit to 300 milligrams per day. That there is the limit for caffeine intake for a pregnant woman. 300 milligrams per day. That equates to about 2 cups of coffee. So just put an asterisk next to that and remember that potentially for the final exam. Okay, so that was an overview of nutrition and healthy eating during pregnancy. Let's move on and look at infants. Okay, a couple of things to note here. Now, the first 6 months of life, milk can supply all of the infant's food, nutrition, and fluid intake. Okay, after 6 months, the introduction of solids is required. Okay, if you remember from week 1, I gave this example of why foods need to be introduced at 6 months. Okay, that's because there is insufficient iron within breast milk. Okay, when an infant is born, the amount of iron which the infant is born with is designed to actually last them 6 months. After that 6 months, then the infant actually requires to consume iron. Now, as there's no iron in breast milk, iron needs to be included within food. So when it comes around to the introduction of solids, it's recommended that iron-containing nutritious rich foods will be the first to be implemented and introduced within the infant's diet. And this would include things such as iron-fortified cereals, sweet potato, and particular meats and poultry dishes to be included. Now, other things to note is that this iron is essential for neurocognitive development. And if insufficient iron occurs in these earlier stages of life, then potential IQ may actually reduce later on in life. A mother is encouraged and can breastfeed up until 12 months or longer if they choose to. There are a number of foods to avoid during the first few years of life, and that is, of course, soft drinks. In fact, all soft drinks should just be avoided completely. I'll tell you, just a few months ago, I was on the train and I saw a woman give a cap of Coke to an infant that would be no more than 3 or 4 months old, and I was shocked. So yes, no soft drinks, even fruit juices, teas, coffees, and other milks such as rice milk and soy milk should all be avoided. Things like raw eggs and honey should be avoided as well. Obvious things such as nuts and raw carrots, which can actually result in a choking hazard, should actually be avoided. Now, cow's milk and cow milk products such as yogurt and cheeses can be given. However, cow's milk shouldn't be the main drink before 12 months of age. Another thing that's not on this slide that I'll add is it's recommended to not add salt to an infant's diet, as the infant's kidneys are not developed and then thereby are unable to excrete excessive amounts of salt. Moving on to children and adolescents. As you can see, we're slowly getting older. So key nutrition issues during childhood and into adolescence. So children are not little adults. So it's not as if we just need to give them a smaller proportion of what adults consume. They require different amounts of micro and macronutrients, especially during puberty, to support with bone development, to support with energy intake. They are classified as a vulnerable population because they are dependent on others for their nutrition. Their different food habits and preferences can actually influence their food choices. The dietary guidelines are actually different. We reviewed this in week 1 and week 2 and how the children's dietary guidelines are different to the adults' dietary guidelines. Now, this is an important element here. Inadequate nutrition may actually compromise growth and development and actually have a long-lasting effect well into adulthood. Now, depending on age, gender, physical activity, and so forth, these demographic characteristics can actually determine how much of a nutrient one requires. So generally speaking, the nutrient reference values of the Australian Dietary Guidelines and so forth will actually increase with age. However, there are a few exceptions to this. Now, total energy, protein, and some micro nutrients are required lower than in adults. Furthermore to this, energy and macro and micronutrients in other elements are actually higher in comparison to adults. Generally speaking, these requirements are higher in boys than in girls. However, there are some exceptions to this, as we will see in the coming slides. Let's first look at calcium. Okay, calcium is required for skeletal development, for muscle development, and of course to achieve peak bone mass. Now, this bone mass will last well into adulthood, and then thereby the RDI of calcium is actually higher during these earlier years than they are the later years, such as adulthood. So looking at this, for both boys and girls, the RDI of calcium for individuals between the ages of 9 and 11 is 100 milligrams, which is about 3 servings of dairy. You fast forward between the ages of 12 and 18, where a lot of this bone mass development occurs. This increases by 300 milligrams to 1300 milligrams, which equates to about 4 servings of dairy per day. The next nutrient which we can discuss is iron. So yes, of course, it is required in larger amounts during these growth spurts. Okay, as there is an expanding in blood volume and an increase in hemoglobin concentration means or results in more iron within the diet, or requires more iron within the diet. These needs decrease after puberty for boys. Okay, however, they remain higher for girls. So let's look down here. For both between the ages of 9 and 13, 8 milligrams per day. Whereas for boys between 14 and 18, it goes up to 11 milligrams per day. And then, as we know in adulthood, that drops back down to about 8 milligrams a day for boys or men. Whereas girls require 15 milligrams, and then that increases furthermore after the age of 18. So there is that increased amount requirement of iron for females. As we can see, the different food groups and the servings per day also differs between children and adolescents. Generally, across the board, they all increase. So looking at fruit, it's generally 1 serving per day for individuals between the ages of 4 and 7, whereas it increases to 3 during the adolescence years. So let's discuss a little more about dietary patterns, habits, behaviors, and influences on children's and adolescents' diets. Let's first look at eating habits. So we're going to compare children versus adolescents. So starting off with children, we can see that they're able to feed themselves independently. This is in comparison to infants, where they don't have that ability. There's generally structured meal times. They eat according to social rules. Sometimes they'll have pocket money and able to buy particular foods. Now these foods are generally offered at food canteens and are actually influenced by both the media, family, friends, and peers. Whereas if we look at adolescents, they have greater control over their own food intake. The influence that family has on their nutrient intake actually decreases. Structure of food habits loosen. They may be employed, working part-time, and then thereby have an ability to purchase more foods. Most adolescents will have a larger appetite and intake in comparison to adults. And they also have non-traditional eating habits. Now you ask, Brad, what are non-traditional eating habits? Let me tell you more. So non-traditional eating habits include a variety of different things. And it's this time in life where diet and the environment can influence the particular habits within our diet. So some adolescents may feel the need to follow a vegan or vegetarian diet for a number of different reasons. They may want to experiment with alcohol and other so-called fun drinks, generally the sugary kind. They're generally missing meals, particularly breakfast. Okay? Generally snacking on soft drinks and takeaway foods. These are considered as non-traditional eating habits and are quite common among adolescents. So meal frequency in comparison between children and adolescents. We can see that children can have regular meals, generally 3 times a day, whereas adolescents will have irregular meals and will actually focus more on snacking. Now, occasions of eating and context of eating influences food and nutrient intake. So as number of eating occasions increase, aka snacking, so does overall energy intake, thereby increasing that risk of weight gain and thereby being overweight and then developing obesity later on. We can see that irregular meal patterns, including skipping meals, are actually associated with weight gain. All right, let's focus. Let's focus and discuss a little more about skipping meals. Of course, this will come without a doubt. Some of you may know this better than I do, as you are closer to your adolescent years than I am. However, it is more common among adolescents than children. Looking at some of the stats from Australia, breakfast is the most common skipped meal, which, as you would know, I say breakfast is the most important meal of the day. We can see that adolescent girls are more frequently, or more likely, or actually skip meals more frequently than boys do. That's 27 versus 42%. Why, you ask? You could say it's a lack of time, or that desire to sleep, or a lack of an appetite, or they're dieting to lose weight in some way. Now, this will result in a lower essential nutrient intake. As we all know, it's quite difficult to meet all of our recommended dietary intakes every day. And if we skip one meal, then we've actually got to ensure that those two other meals are more nutritious rich. And I guarantee you that doesn't happen during these teenage years. Skipping breakfast can actually affect concentration, learning, and school performance. Snacking. I guarantee those of you who are quarantined at home during these times are potentially snacking more often. I know that myself, I am a culprit for that. However, there are some things we need to discuss about snacking. Generally speaking, it increases with age, during teenage years. Whereas if we look at some of the stats, yes, it's most common among adolescents during the teenage years, and 20 to 30% of children will have 3 to 4 snacks per day, whereas 5 to 15% will consume over 5 snacks per day. Now, these aren't celery sticks and carrot sticks or a banana. These snacks are generally high in sugar, sodium, and fat, and of course low in vitamins and minerals. So these are not the snacks that adolescents will consume. They should consume these, berries and carrots and nuts and seeds and so forth. However, they rely on the foods which are higher in the sugar, sodium, and fat. What's quite interesting is it actually contributes more energy to the diet than the 3 main meals. And without a doubt, frequent snacking is associated with overweight. The more kilojoules you consume, the less exercise you do, the more weight you gain. Beverages. I've always said that concentrated fruit juices and soft drinks are some of the worst food products ever developed. They lack fiber, they lack vitamins and minerals. They're basically empty calories. And simply just by removing these soft drinks and cordials from the diet can have a significant improvement. However, adolescents will actually drink a lot of these drinks, and they are actually available at home. Family meals, really important element when we come around to supporting adolescents and children. What has been shown is that these family meals are associated with a better overall dietary quality among both children and adolescents. It would make sense that dinner is the most frequently consumed family meal. A good 80% of New South Wales school children will eat dinner at home. However, there's still about that 20% that will eat it in front of the TV. Now, this can have a number of effects. Those eating meals in front of the TV have been shown to consume more kilojoules than those who are not sitting in front of the TV. It's this mindless eating. In addition, unhealthier foods may be consumed in front of the TV. what is known about these family meals is it provides the largest proportion of energy and essential nutrients than other meals and snacks. However, the number of family meals eaten, especially dinner, will reduce with age. So as a teenager goes around puberty and goes into their later teens, the number of family meals will actually reduce. This is because they may be busy. They may have family issues. They may have a part-time job, or they just may not want to partake in family meals. Fast food. The reason why I have a job as a nutritionist. I tell you, if fast food just disappeared, the rates of disease would reduce and I'd be out of a job. Regardless, looking at children and adolescents and their consumption of fast food, these items tend to be higher in sugar and fat and lower in essential nutrients in comparison to food which is prepared at home. As you can imagine, fast food is commonly consumed in adolescence. What are some of these factors that can influence food choice within children? I would say the biggest one is taste, and even, let's say, the look of the food. If the food doesn't taste nice, it doesn't look nice, the children are less likely to eat it. You've got picky eaters. Other elements at play here include the family environment. So if a child observes mum and dad eating a salad, a healthy, nutritious, rich meal, they're more likely to do the same. However, if the parents are eating an unhealthy foods, then the child will learn those bad habits. Another one is peer pressure. If a child sees their peers consuming unhealthy foods, then that may have an influence on the choices that they want to include. Another major one is social media, marketing, and advertising. Advertising junk food during children programs can have a major and long-lasting effect on the choices in which children want to follow for the intake of particular food items. And it's linked to obesity. Now let's look at some of the factors which influence food choice for adolescents, our teenagers. Let's look at the most important. The most important factors is hunger. When a teenager is hungry, they'll just eat anything, won't they? This will include taste as well. Time, and this may be the amount of time it takes to make a food or purchase a food item, can be a factor that influences their choice on these food items. Also, convenience. Is the food item easy to get access to? If it is, that there is a factor at play. Now, what's less important for adolescents is body image, cost, and habits associated with some of these food items. Nutrients at risk for children. Now, the majority of children in all age groups will meet the EAR of all nutrients except calcium and magnesium. Now, look at this stat here. About 80 to 90% of girls do not meet their calcium requirements. You know what that's going to result in later on in life? Osteoporosis. Another one is magnesium. About 50% of young girls don't actually meet the EAR for magnesium intake. Adequate nutrition during childhood and adolescence. Some of the consequences that may come into play here is things like iron deficiency, poor academic performance, poor bone mineral density. We've seen this with the calcium. Increase the risk of osteoporosis. stunted growth, delayed puberty. If there's inadequate nutrition during these early years in life, a number of health consequences can be the result of that. Okay, so some common nutrition issues that face children and adolescents include dieting and eating disorders, dental decay, and overweight and obesity. So what we'll do is we will discuss these now, starting off with dieting and eating disorders. Some research actually indicates that this dieting can actually affect children as young as 7 years of age, which is very concerning from a nutritionist's perspective. Now, dieting to lose/control weight is a common behavior in adolescence, and it's most common in girls. So 40 to 50% of teenage girls may experience some dieting to lose weight or control weight, and that is in comparison to about 20% for boys. This dieting and eating disorders can be associated with low self-esteem, negative body image. It can be impacted by social media and peer pressure, trying to get this ideal body image, which is just unrealistic. Just a few of the elements in which dieting and eating disorders may be associated with. There are a number of, let's say, dieting and eating disorders that we can discuss. Vegetarianism or veganism, it isn't a eating disorder. However, a number of young, especially young females, will try out this particular diet. They may also try fasting, skipping meals, especially breakfast, avoiding snacks. In some individuals, excluding whole food groups. Now, we know if we remove a particular food group, then we're at a greater risk of developing disease, both short-term and long-term. Some individuals who have got lower, let's say, health knowledge or nutrition knowledge will actually exclude fat. Yet we know that fat is essential and we require some fat in our diet for optimal health. Some may do calorie counting and chewing but not swallowing. They may use slimming pills, diuretics, laxatives, all of these elements to reduce body weight. However, a number of these are actually associated with negative side effects, both short-term and long-term. Short-term, you'd be thinking of things like body development, depression, and other mental health conditions. Long-term, potentially risk of chronic disease, osteoporosis, and other conditions. Eating disorders and dieting, particular strategies for prevention. Discourage unhealthy eating. This comes down to the peers, the friends, the family environment. We need to discourage this unhealthy dieting and this unhealthy eating habits and actually encourage sustainable eating, physical activity. We want to promote positive body image, promote that the individual does look good, that they are of a healthy weight, and that they shouldn't be influenced by social media. Okay, encourage frequent meals with the family. Why? As we just learned, these meals eaten at home are more nutritious, and the family members can actually support them to ensure that they are eating. Encourage families to talk less about weight and do more to support healthy eating and healthy eating behaviors at home. The next nutrition issue affecting a number of children and teenagers can be dental cavities or dental decay. Now, in the past 2 to 3 decades, it has actually reduced. However, it's still the second most expensive diet-related public health problem in Australia. Children with early cavities have risk of other dental decay later on in life. It's associated with a number of, let's say, loss of teeth, abscess formation, infection. What are some of the symptoms of dental decay? It'd be pain, problems eating and drinking, sleeping, social embarrassment, and are reduced in academic performance, may be symptoms of dental decay. So what are some of the causes for dental decay and cavities? Excessive plaque buildup. So that is infrequent cleaning, so not brushing teeth 2 times a day, morning and night. Or substandard teeth cleaning, so that may include not flossing or only brushing teeth for a short period of time, for 30 seconds rather than 2 minutes. Frequent exposure to things like acidic drinks, fermented sugars. Reduced saliva flow can be a factor at play here due to medications. Limited exposure to fluoride. We know that fluoride supports with healthy teeth development, and those who are not using fluoride toothpaste may be at a greater risk of these cavities, or those who are on tank water or consuming non-fluoride water may potentially be at a greater risk of cavities. So what are some of the strategies at play here? Let's go dietary modification, focusing on food. Avoid snacking, especially on sugary and sticky things such as, what are those lollies that say caramel? You know how they stick to your teeth? Avoid those particular foods between meals. In regards to drinks, avoid the acidic and sugary drinks between meals. Support with healthy oral hygiene. That is, brush teeth twice daily, use fluoride toothpaste, and of course get dental or regular dental checkups up until the age of 18. All of these strategies can go on to support a reduced risk of dental cavities during these early years of life. So the last one we will discuss is overweight and obesity. Although we have discussed this throughout the subject so far, let's focus more so on the influence and impact in the earlier years in life. Now, as we know, obesity, broadly speaking, can come down to energy in, energy out. If we consume too much and not exercise enough, then the odds of gaining weight and becoming overweight and getting obesity will increase. Factors that contribute to the imbalance in children can be a number of factors. So this is the consumption of energy-dense and nutrient-poor foods. And you know what I'm going to say? Soft drinks, cordials. You've also got a lack of physical activity, and even screen time can increase the risk and the odds of obesity and being overweight. What is the prevalence of obesity in children in Australia? So among 1/4, so that's about 25% of children aged between 5 and 17 were overweight or obese in 2017, 2018. 1/4, that is a lot of individuals who are overweight. Social factors. So there's a high prevalence among low social economic status. So 2.4 times, right? Other ethnic groups such as Middle East descent, Pacific Islanders, Indigenous Australians, they have got that higher prevalence of being overweight and obese in childhood in comparison to others. There are ways that we can actually prevent this in childhood. Some of them may be particular programs such as Go for Fun, which encourages the consumption of healthy foods, fruits and vegetables, and excluding the sugary drinks. Another preventative method may be the advertising that is seen on TV, avoiding fast food and junk food advertising during shows which are directed at children. Potential taxes on unhealthy foods and then subsidies for healthier foods, so families can actually support and be able to afford healthier options. These are just a number of the ways that we can actually prevent some of this development of obesity and overweight within childhood and adolescence. Yes, good diet is essential, but there's other external factors at play here, and they all contribute to why we're seeing about 25% of children and adolescents actually become overweight and obese. This brings us to the end of Nutrition and Healthy Eating Session 8. I hope you have enjoyed this, and I will see you all next time.